We're going to talk about the Wolverine Protocol today. So, mosquito buzzing around the internet, gaining popularity. It's two ingredients combined together. We'll take one at a time, and then we'll talk about the synergistic effect of both together. So, we have BPC 157. Now, am I correct, doctor, that that stands for body protection compound?
Compound or complex, depending on who
Got it.
you listen to. But
Got it.
yes, yes.
And then we have TB-500, which I think takes a little bit of a different pathway, and this is why these work together synergistically.
Correct. They do
So,
similar things for different reasons.
got it. Cool. So we'll talk about that. Stick around for the last half of the call because we'll talk about what is called the Wolverine Protocol, and I think this originated from the movie, the Wolverine.
Well, it's interesting. I was listening to a podcaster this weekend who said that he named it.
Oh, really?
Yes. So
Dr. Trevor?
absolutely.
Yeah. He likes to take credit for that. It's funny though, but if you talk to AI, they'll talk about the movie.
They talk about the movie as well, and that makes more sense to me. And
Right.
it's of course it predated Dr. Trevor being on there.
Right.
Um, we can
Well, he's a very knowledgeable dude, that's for sure. But let's just dive right in and talk about that because a lot of what he promotes and a lot of these guys promote, it says right on the vial, not for human use or lab use only or for animal use only. Is that the category this is still falling into as far as that goes, as far as FDA approval goes?
As far as FDA approval, it can be compounded by FDA compliant compounding pharmacies,
Got it.
but it is not past second and third phase trials. So there are some trials out there, even related to things like post-stroke and post-heart attack for recovery. Obviously, there should be some orthopedic things in there, but I guarantee you that there are trials going on now to get it FDA approved, but that would be by a pharmaceutical company that wants to trademark it.
So you can still get it through a compounding pharmacy if prescribed to by a doctor. Am I correct? Is that the key?
You can, but it would not be what's considered research grade.
Got it.
Yeah.
Right. And I think that that's the issue too, is a lot of these peptides that are bought that say that on the label, we're finding out that when you test that, you really don't know the efficacy if the precise amounts are in there. And of course, when a compounding pharmacy does it, you know what's in the bottle or on the labels in the bottle, correct?
Yes, you can't deviate more than 5% on either way from a compounded pharmacy that's FDA regulated. If you go to one of these research companies and people who do their own third-party testing post-purchase, they're finding it can be anywhere from a third to three times as much as the bottle is indicating.
Right.
Um,
That's the challenge. Well, let's talk about what it does. So let's first of all, let's talk about real quick, just do a quick summary of BPC 157. It's a synthetic peptide. It's derived from a protein, right? So can you tell us more about that?
Yeah, so the protein was discovered, I believe, in the early 90s while they were investigating panaceas for pain in people. And this was in Zagreb, if I'm not mistaken. And what they found was a protein in the gut, in the stomach. And part of that, a fraction of that was what was called BBC 157. So a body protection compound 157. It's a 15 amino acid peptide that is stable in gut acid. So that's why it's so phenomenal, because that's the problem with most proteins is they don't survive getting through the gut if you take them orally. So in this case, it seems to work great for the gut. So internally, if you take it by mouth, it seems to work really well. There's a lot of data on whether how it compares to what we call PPIs, proton inhibitors, medication we use for ulcers. The BBC does better in some research projects. Also, for ulcerative colitis, they've seen some reversal of the symptoms of ulcerative colitis in human studies as well as animal studies. So it works orally, which is an exception to most of the peptides. It also works by injection. And when it does it by injection, it seems to work best by improving something called vascular production. And also, it does that by promoting more what's called VEGF receptor activity. And then the other thing, it helps with nitric oxide. It helps get rid of immune products, IL-6, TNF alpha, some of these other things that most of us are familiar with for inflammation. but it seems to be more of a local effect. It seems to go to where there's a problem. So what we do with the injection, let's say you have a shoulder problem, we tend to inject it in the area of where the problem is. There's even one study, it's a small study, but it was a group of individuals that had knee pain where they actually injected BPC-157 directly into the knee. And two-thirds of the people had improvement of their pain, significant improvement of their pain up to 6 months.
So I'm going to talk about that a little bit. So I have a compounded pharmacy version of the Wolverine Protocol, which is the BPC-157 and the TB-500, which we'll talk about here in a second. And from what I understand, it does not matter if you inject the TB-500 locally as much as it does the BP-157. I'll let you elaborate on that in a second. But I have the combination together in a bottle. So I
Right.
just inject it right into my shoulder. And I've had two shoulder surgeries, one on each side, a labrum one that took really well and one that didn't take really well because my rotator cuff is shredded. Now, my main thing that I've noticed, and I had the same type of effect with stem cells, is that my pain at night when I sleep is gone. Okay.
Yes, that's one of the first indicators.
Right. And so I can tell that it's already helping from an inflammation standpoint because I would lay there in bed at night and I would just could not get comfortable because my shoulder would nag at me. And then of course when I drive up north to see my grandsons, it's like an hour and a half drive to see them. And sometimes I'd have to like it's so weird. You're just sitting there and if you're in the wrong spot, it's almost like I have to pull over and find an excuse to go to the bathroom just to get out of the car to get rid of the pain. And that's gone as well doing this protocol. Now with that being said, I've been running it for about 8 weeks now, and dummy me, I had a shoulder mishap setback a couple weeks ago,
Mhm.
and so now it's very hard for me to judge if it's working on the shoulder or not because I did something stupid with my grandkids playing with them and pulled my shoulder out again. So
Right.
I'm back at it again, and to be continued. But again, going back to that nagging pain at night being gone, and I think we all can agree you can't put a price tag on being out of pain naturally.
Absolutely.
Right.
And you're not going to have pain unless you have some inflammatory component there. Sending the messengers to the nerves to send the message to your brain, which gets interpreted as pain.
Right.
But locally, what we find is that the BBC 157 actually helps a great deal with tendons and ligaments. So, just for your audience, ligaments hold bone to bone, tendons hold muscle to bone. And so, when somebody says they sprain a tendon, there's no such thing. You strain a tendon, you sprain a ligament.
Got it.
Okay? And so, they can be helpful for both. The labrum is kind of in between because it kind of holds bone to bone, but also the biceps attaches to it. So it's kind of a tendon attaching it to it. So that's kind of an in-between type of organ. We also know that you cannot substitute the rehab, the correct posturing, the focused on improvement, progressive resistance exercise to improve the tendon as well. We know that there's other things we can talk about this a different day, but blood flow restriction can be helpful where you can use a lighter weight to get the same sort of changes that you want, those sort of things. But the BBC 157 has more of a local effect, which is why you tend to inject it more local, as opposed to TB 500, which tends to have more of a systemic effect.
And if you want to, like for me, I'm not bothered by shoving an insulin needle in my muscles. If
Yes.
you're bothered by that, my understanding is you could still like pinch your belly fat and shove it in there and inject it as well. And of course, then you have the oral option, which is, I know it's more for gut healing as
Yeah.
well. So at the root of it, BP-157. What is like, if you were to say the top three things that it does in order of most powerful healing modalities, what would you say the pathways are? Reduced inflammation, tissue regrowth. Can you explain a little bit that and kind of dumb that down for us a little bit?
Yeah. So I would tell you the number one thing that it's known for, and there's some good science behind that, is improvement of gut health. Especially, ulcers, irritable bowel type of things, and also ulcerative colitis are an inflammatory condition of the bowel, which can be done orally. Okay, so that's number one. So if you're going to use it for injection, it seems to help with increasing the the blood flow to the area, and that's an angiogenesis that it does. And actually, there's the particular thing is that it increases VAGF, it increases the receptor activity or amount so that this vasoactive protein actually improves your vascularity, which improves this. So tendons notoriously have bad blood supply. Cartilage has bad blood supply, and also the ligaments do as well. So this helps improve the blood supply of those areas.
Got it.
And so that's where the main course is. So if you have if you have a knee problem, if you have a ligament problem around the knee, if you are, I can tell you one of the places I used it for fairly recently is pre-knee replacement and post-knee replacement as part of rehab. Now, the person who I'm doing this with had had a previous knee replacement, and he had had a different doctor give him that cocktail, and it worked great for him. Now, the only thing is, if you're increasing angiogenesis pre-surgery, you got to worry about the bleeding at surgery. So you're not going to make an orthopedic surgeon happy if he can't clear the field and see as well.
Right.
So you got to stop it a little bit beforehand, a few days beforehand, make sure you're not on anything else. But it definitely is a great anti-inflammatory as well. And so that's why it helps with the pain. And that's why, as soon as maybe 3 to 5 days after you start it, the nighttime pain may be better. Now, you can talk about most efficacy you're going to see is probably going to be in the 2 to 4 week range. And then we commonly use it up to about 8 weeks on a cycle. And hopefully you're doing better as you're doing your rehab. And then, of course, if you have another re-injury, what do you do? Do you up the dose? Well, I would tell you that initially you might want to use 1 milligram as your daily dose as opposed to 250 to 500 micrograms. So if you got a cc syringe and
Mhm.
it's 1 milligram per mil, you would use the whole syringe
A
versus
lot.
a quarter to half of it if you have a new injury. You might want to up the dose for about 7 to 10 days, and then you go back to kind of the 500 or half of that dose for a period of 6 to 8 weeks.
Great. Okay, that's good because I was going to ask about dosing. So backing up a little bit, something interesting you said about blood flow.
Yeah.
And if you think about this from a healing standpoint, just as humans in general, if we set aside BPC-157, even when you do cold restriction, right, or cold therapy, you're actually reducing recovery time. And research even shows now you're reducing muscle growth. You are actually, they're talking about how now the newest study shows that you eat more after cold exposure because it's a stressor, right? And so people are gaining weight who do
Cortisol
it.
goes up. Yep.
So again, this kind of goes back to I think like an ibuprofen where it's going to be beneficial to help with the pain, but you're masking the real pain versus blood flow. And they've done this with injuries, which is there's a lot of subjectiveness in injuries, right? Because one injury can be a different level than another, but they've done groups of people and athletes with injuries where one group does the icing and the other group does the blood flow and the moving, and they heal faster because the blood flow is in that area to help with healing. So, although things like cold therapy can be a short term stressor and reduce pain, at the end of the day, the blood flow or increasing heat or blood flow to the area is going to be more beneficial ongoing, even if you're in more pain, because you're actually accelerating the healing process versus reducing it. Am I correct by saying that?
You're right. If you go back physiologically after you've had an injury, you actually want inflammation in the first 7 to 10 days. That's a typical biologic healing process. So you get what's called hyperemic. You're bringing more blood flow into that. And so the price or the rice therapy you're talking about, where you're going to rest it. Well, first of all, rest is not a good therapy. Rest is actually going to decondition you. So we're not advocates in rehab, and my background is sports rehab. I'm not an advocate of that. I'm doing something that is in a comfortable position to keep you active. Hell, I know that you can even exercise the other limb and get a crossover effect. We know that from stroke rehab and things like that. Okay. So what happens is we want to continue to get the increase in blood flow to the area. Ice restricts that. So we know that that's not beneficial. It feels good.
Right.
I mean, afterwards, you're going to get some momentary relief, but actually can impede your recovery, just like an anti-inflammatory can impede your recovery. So you've had stem cells. So we will tell you whether you've had platelets or stem cells that you don't want to take any anti-inflammatories a week or so before and 2 weeks afterwards. And the reason is you want the inflammatory effect and the increase in blood flow. And so then the normal healing is that those stem cells are coming in, you're inviting them there. If it's platelets, if you already are putting stem cells in, whether they're your own or whether they're from placental stem cells or other things, they have got the messenger and the messagee in that area to get it to heal. One of the things is you can get abnormal healing, lots of scar tissue, things like that. And the BBC 157 seems to help with decreasing the amount of aberrant healing that you get. So you get more natural healing.
And I think this goes back to what we were talking about on our last call. This is going to work in addition to doing all the other stuff, right? I mean, if you're boozing it up and sitting around and doing stupid stuff, right, and you're living an unhealthy lifestyle and you're not doing your rehab or your stretching or your mobility work or working out or exercising and nutrition and all that stuff is going to play a role in how this stuff works. So
Right.
again, a lot of people, they love the idea of a pill and they love the idea of just a quick needle shot because they don't want to do the work. So I just want to drive the point home that just like all things that we talk about that are mechanisms to help people be healthier, these mechanisms work in synergy with healthy lifestyle habits. So I just want to,
Absolutely. And you don't have to go very far to look at some of the NBA players that have had, or former NBA players that have had kidney transplants because of their daily use of anti-inflammatories while they were playing.
right,
Not a
right.
good strategy. So you don't want to injure first, right? Do no harm. And we do not see, and there's nothing right now that looks lethal or significantly detrimental to using BBC 157 or TB 500.
Yeah, I mean, there's some guys out there who are biohackers and they're doing that full-blown needle every day sometimes. A lot of them are like on big injuries, right? Not that we advocate any of that, but the use seems to be very safe. And
Correct.
so back to the dosing, just to kind of close that loop, the dosing is going to really be dependent on the severity of the injury sometimes.
It can be, yes.
Yeah.
So, or the recentness of the injury. So, yes. So, if you've had a recent injury, you might want to start at a higher dose and then go into a maintenance dose after the first couple of weeks. Again, the primary inflammatory effect from an injury biologically is about 7 to 10 days that you have, more inflammation to start the healing process to invite your own stem cells and reparative process to begin.
Yeah. Any side effects from this that you know of, Doc?
The BBC 157, I think there's, things like some people, if they take it orally, get a little nauseated. There's obviously injection problems if you don't have bactericidal water, if you're reconstituting yourself. And if it is reconstituted, we don't tend to see that. If you're using a high dose for a period of time, BBC 157 and TB 500, the receptors can become saturated. You may not have the same effect. And so sometimes taking a holiday, maybe doing it 5 days of the 7 day week rather than every day.
I think that's the same case with a lot of supplements out there that can improve certain aspects of health. You're going to build up a tolerance and your receptors are going to downregulate. It's just part of the process. It's like me, I could probably drink a cup of coffee at 8 p.m. and still sleep like a baby, and that's just not right.
Well, and that's your genetics. That you're a fast metabolizer. If I
Yeah.
drink any coffee afternoon, I can't sleep.
Right, the exact opposite. Exactly. My wife's the same way, man. She can't touch caffeine after noon, right?
No,
I could have a freaking energy drink at 3 p.m. and still sleep like a baby at 10:30 at night, So,
okay,
yeah.
you're clearing that out, but you probably, I would tell you from people that have my genetics that your caffeine should all be done within probably 90 minutes of awakening.
Right. It should
But I
be.
would,
I agree.
and I'm an advocate of, 300 or 400 milligrams of it, however you get it. So it doesn't have to be a small amount, but for brain health and things like that, I think, and it's such a great ergogenic aid.
I mean, I think that we got a very few, there's probably a handful of supplements that you can count that have massive research like creatine, right? And of course, adequate protein intake. We can make the case for protein powder. It's not necessary, but it definitely helps when you can't hit your mark, right?
Yes,
And then we, that flies right into that category as well, right? Caffeine as well.
caffeine.
So,
Yep.
well, we're in a whole new level now with these peptides. So, just normal side effects that are probably going to be, again, this goes back to probably a small percentage of the population. I know personally, I had zero side effects from it. And so does my wife. And by the way, my wife too has been talking about how she just always complains about her shoulders when she works out.
Yes.
And ever since she started doing this about 8 weeks ago, a couple weeks in, she just has zero complaints about her shoulders not aching, like she's not coming upstairs aching. And I kind of noticed that, right? So, we all seem to like we tend to forget. It goes back to when you're healthy, you got all kinds of problems. When you're not, you have one.
You have one. That's exactly right.
You notice it, right? And then when it goes away, it's like, okay, on to the next thing.
Yeah.
All right. Anything else that you want to mention on this particular compound before we move into TB-500, which seems to work in synergy with this?
I think that that's primarily it. I would say that there, whether you use it in combination or separate at higher doses, there has been some complaints of fatigability.
Yeah.
I think it's more with the higher doses of TB-500, but there have some people. So there's right now it's a little controversial, but does it actually cause fatigue in some people?
And that's TB-500. So tell us more about that particular ingredient. And what is it? I see here is like thymosin beta 4 fragment, right? That's
Yeah, so originally thymosin beta 4 made from a thymus gland, which usually goes away in people after about 18 or 19 years old, and it has to do with your immune system. And so the thymosin beta 4 is 43 amino acids, and the TB-500, the synthetic version of it, is 7 amino acids, but it tends to have the same effect as the larger chain. And just again, peptides are 2 to 50 kind of amino acids in a chain, and
got it.
50 is getting up in the range of insulin. And
Okay.
everybody's familiar with insulin.
Right.
Okay. And anybody that doesn't think that peptides haven't been around for a while, that's been here for more than 100 years, saving
Crazy.
people's lives, right? Um, and then, there's other ones, oxytocin that we use for women and when they're having babies and things like that, and vasopressin for raising blood pressure in an ICU patient. Those are all peptides,
Got it.
chains of amino
You
acids.
just never heard it put that way before.
No, you didn't hear it put that way, but they've been around from what we know. And again, there's 120 amino acids that are actually FDA approved and probably 127. They're being investigated, and there's probably 1,200 that we know of.
So this is just the tip of the iceberg on how many chains we could string up together here to come up with healing compounds.
That's exactly right. And so using fragments. So the TB-500, again, the idea was that it would help your immune system. But what it found was it was a generalized repair system. Again, angiogenesis is part of what it does. What we talked about, BPC-157, it actually increased the VAGF receptors. The TB-500 increases the VAGF production. So that's why they can work well together.
Got it.
It tends to have more of a systemic effect. We know that it has been seen again in post-heart attack patients. We've seen it being used in people with uh, cardiac output problems. So, they're not actually, their heart's not working as well. We know that it's been seen, especially in animal studies post-stroke. So it helps with neurorestoration as well. So it seems to be very, very effective. Doesn't have to be used as often. So there's some people will split it out. There are people that use it together and same mix, and they're using it more often, but you can use anywhere between 2 milligrams and 10 milligrams a week of the TB-500. And some people will just do like the 1 or 2 milligrams twice a week, kind of for the happy place in there. So it depends on your mix. So if you are using it more often, you're going to be at a smaller dose, be somewhere between 2 and 10 milligrams for the week by the time you're done.
Does this have the same effect as far as down regulating the receptors where your body can build up a tolerance over time as well?
Yeah, the idea is that just about anything you use consistently will basically feel the receptors and the receptors will downgrade. It doesn't matter if you're using a supplement or whether or not you're doing a peptide injection, that potential exists.
Yeah, is there a recommended time frame you have, or again, case by case?
The length of time you use it.
Yes.
Again, I don't have an exact protocol, but usually I do about an 8 week course
Hmm.
when I do it. And then some people will stay it on lower doses and continue that.
Got it.
But at least the higher doses, I'm going to be kind of in the 14-day range for the higher doses, whether it's pre-surgery, post-injury, post-surgery, and then I tend to come bring it down to moderate dose. And after 8 weeks, I will discontinue it and have a holiday, maybe bring it back, or I would go to a lower dose for maintenance, depending on the client.
And of course, this goes back to, hopping on a call and going through your situation, customizing the dosing, using titration if necessary as well, correct?
That's right. So the bottom line is everybody is different. They're genetically, phenotypically, the expression of their genes differently. They metabolize differently, going back to the coffee use. Everybody is different. And so if you just have a one size fits all, it ends up being a one size fits no one.
Right.
So we want to personalize it, and the interaction between the patient client and the physician ordering it is going to be penultimate because you want to make sure that it's good for you.
This is exactly why I never started talking about these things until I partnered with you guys. Because I just see a lot of influencers out there that I'm not questioning their knowledge. They seem very smart, but then they're sending people off to like a lab rat. Like, you know what I mean? And just like, hey, here's where you can buy it. Check off this box that it's not for human use. And, here's the protocol I use. This is not medical advice, right?
Right.
So it's kind of like, okay, you're kind of in the wild, wild west now, right?
Well,
And then that goes back to you don't even know if you're getting the real stuff because it's not compounded by FDA approved pharmacy as well. So we have all kinds of stuff here,
and some
that's
of those influencers obviously don't have medical licenses that
right,
they're putting at risk. They don't have a necessarily, if you get a reaction to something from a research platform, there's no liability for anybody. It says use at your own risk.
right. And they're
Oh,
covering their ass, which makes sense.
correct, which I can't do that. I'm responsible for everything that happens after that.
Yeah, that's why I'm having you on this interview because you guys have everything compliant and dialed in. The process of the vetting, the customization, the integrity behind that, and the testing, knowing that everybody's getting quality and I mean, I went through this with the pill industry, right?
Yes,
To make a
sir.
pill, I would pay $5 more a bottle than somebody who made a crappy pill, and I couldn't compete with them because I was third party testing and doing it right. And so
Correct.
this is what's happening with the peptide. And there's not many companies out there that I know of at all, like you guys, who have, you got the HIPAA compliant, you got the FDA compliance, it's not just the cost of the medicine, you're getting the blood work and the coaching with it, the customization, the titration. So just a side note of that. Now, what else on TB-500 do we need to know? Is there other side effects to this as well, or is there any, I know we want to stack it with BP-157. There's a couple ways to do that you mentioned that. Is there risk of combining them or anything like that, doctor?
I've not seen any risk of combining them. They work synergistically. So as I said, they sort of achieve the same outcome for different reasons. They both are going to focus on increase in vascularity for that area of the injury. They're going to actually decrease the eventually decrease the inflammatory products. That's what we want. One has a little bit more of a local effect, the BBC-157. The TB-500 has a little bit of more of a systemic effect. So you're getting both of those. And I think that's commonly why they're used together. Have I used them individually? Absolutely, I've used them individually. But I think together, again, why did they come up with the name the Wolverine? Because of the repair we see. And I would tell you one of the anecdotes that I've seen that is more common is somebody does a CrossFit competition and they get the delayed onset muscle soreness that can last for days. Well, they don't seem to get that if they're on BBC 157 and TB 500.
Yeah, it's interesting, because even cold plunging, the one area where it was shown to be effective was Olympic athletes who had multi-event trainings on the same day. If they cold plunge between the events, that acute cold exposure helped them recover quickly, faster for the multi-events. But if you start spreading it over multiple days, now you have diminishing returns.
Yes, exactly right.
So
Exactly right. So for athletes, and of course, TB 500 is prohibited by WADA, so it's considered an ergogenic aid or a performance enhancer. So it's illegal as far as for athletes,
at the
professional athletes
Olympics and
in a
yeah,
competition. So if they're testing, if they can test it, but it is if they find out that you were using it, it's not going to be good.
it's an indication it works.
It's an indication it works. Now that's not BBC 157.
Right.
That's not disqualifying by WADA.
Oh,
So
really? Interesting. So I think the take home here, more than anything, what I've taken away from this call, what I think is interesting is there's a lot of guys out there who are talking about how you should never go off this, but that's definitely not the case. And I've heard this from more than one source outside yourself, Dr. B, that your receptors are going to downregulate. It should be a six to 8 week run. Then you take a little break, and then you go on another 6 to 8 week run. And of
Yeah,
course, if you do things like this with caffeine, the same thing will happen. Like you start bringing caffeine back in after taking some time off, it's going to light your ass up. So,
right,
right.
exactly.
Here's like, because you build up a tolerance really fast. And so I thought that was really good. Adjusting the dosing according to the injury. And of course, that's a case by case basis. Another reason to get professional advice. So there'll be
Right.
a link around this video. If you guys want any help with this, you can hop on a call with Dr. B and his team, and they'll walk you through everything that you need to do if you're interested in something like this. The same thing with the GLP-1s as well. So is there anything in the peptide world right now that you think will come out and trump this as like a long, because this is one of the more lifestyle longevity ones that you should be rotating in and out of your life. It sounds like consistently forever if you want good joint, tendon, ligament health, right? And over systemic anti-inflammatory effects. Is that correct?
Correct. So inflammation obviously is the reason why we age. And so we know that. And we have more and more inflammation as we age. So that's why it can be helpful. That's why some people are using it full time because they think that ultimately that's what they're going to get to. I'm going to tell you that inflammation is also influenced by your immune health and your cellular health. So I will tell you what's going to be trumping this in the future is anything that increases your ATP production through oxidative phosphorylation. And so that's going to be your SS31 and your MOTS-C and your other mitochondrial peptides.
And then we're
And
going to talk about those coming up in future calls. I'm
I
excited
think,
about that.
right. So
Um,
I will tell you for your being in the gym, I
mhm.
mean, it's great not to hurt, but it's also great to see lifting go up and you're not fatiguing after 5 reps on something you did 10 reps the last time. It's
Right.
amazing what it can do as far as your output. And so I'm a big fan of mitochondria. I'm a big fan of improving your cellular health is one of the bedrocks for making peptides most effective.
Yeah, I mean, all the new research showing this, electronic chain transport, right? And that whole like the mitochondrial function and all that, and how your body. This goes back to, conversations I have on my handle about calories in, calories out. Okay, it can work, and it's probably first base. Like we can't like go to second base without it, right? It has to be there. But there's some people, especially females, who can be like Rubik's cubes. We're one cell amoebas as men, and they're Rubik's cubes. They're complex. Where I'll put them on a reverse diet and
Yeah,
get results from them because they've been in a deficit for so dang long. They got their hormones all jacked up. So there's exceptions to the rule. But
yep,
again, this goes back to, you know, calories in, calories out. If it's broken and not working for you, a lot of times it's at the mitochondrial level. Your mitochondria is broken, right? This is
that's
where I see people who are struggling with, they haven't had glucose in their diet forever and they're on keto. Let's bring carbs back in and get your mitochondria be reactivated, and vice versa. You've been a
yep,
carbophobe eating crap out of a box. Well, let's shut off those sugars for a week, right? And get that body back fat adapted again and get the mitochondrial responding. So it does go both ways, and there's 1,000 ways to skin the cat. It's an exciting new era of medicine. And so hopefully next week or next week or two, we can talk about the couple that you mentioned, the MOTS-C and the SS31. These are more of the mitochondrial peptides, correct? And are these approved by the FDA yet?
there were, yes, SS31 was just approved for some mitochondrial myopathies.
Awesome.
Um, so that was about 4 or 5 weeks ago. Time goes by pretty quickly. So I think it might have been 5 weeks ago.
Remember
So
hearing that. Yeah. So,
and and that usually right now SS31, if you can get it, it's through research platforms.
right.
Many of the compounding pharmacies are doing that, but MOTS-C is usually available.
Got it.
Maybe not the dose strength I would like. I would like it to be a stronger dose so you don't have to inject as much,
Got
um,
it.
because I think it's so great. But right now, it's sort of the standard issue on the FDA compliance is you do, 10 milligrams per 5 ml. And that's about as strong as you can get, although I would like it to be about 40 milligrams per 5 mils.
So
So
are you guys able to offer that at Apex right now legally?
we're able to do Mot C at the 10 milligrams per 5 mils. So we're
Got it.
still the compounding pharmacy that one of them that we're using is petitioning to
Got
increase
it.
dosing. Yeah.
SS31 coming.
SS31 is going to be interesting. It should be available because it's FDA approved. You would expect that more compounding pharmacies would do that. Yes.
Got
So
it.
I expect to see that. And I think, even I may be wrong about this, but I think Andrew Huberman even did a podcast on how he thought that might be the most impactful peptide coming up. It
Interesting.